Hey everybody, Randy Kurtz here for the ISB with the stretch or tip of the month. So thank you for keeping the suggestions coming. I appreciate that. I also have been hearing from some educators who say that some of these tips are helping some of their students. That's fantastic. I'll try to keep that in mind when doing these in the future, and please keep the suggestions coming to the ISB or to me personally. So this month I've talked to some world-class bass players, and a particular subject has been coming up, which is that of bursitis. Bursitis is shoulder pain similar to tendinitis. Tendinitis is an inflammation of a tendon which attaches muscle to bone. Bursitis is when a bursa, which is a fluid-filled sac which goes underneath a tendon, between a tendon and a bone, becomes inflamed. For example, the most common example for our purposes would be the shoulder. So here we have a muscle called the supraspinatus, which is part of the rotator cuff. And this muscle comes into play when we're extending the arm outward in a movement called abduction, or away from the body. So there's a little dimple there that you can feel, and that is where the tendon of the supraspinatus goes, and underneath that is the bursa. So the tendon goes over, the bursa goes underneath, and the bursa is there so that the tendon does not rub up against the bone of the arm, which if it did that continuously day in and day out would not only become aggravated, but would fray the tendon as you used that muscle. So what happens is when one gets tendinitis from too much overuse or repetitive motion, the bursa underneath can also become affected because of that same motion. So treatment will be similar for both conditions. Acupuncture can be good. Ultrasound is really good. Ultrasound being the modality that gets into that area and reduces inflammation. These are both things that I use very effectively for this condition, and I see this all the time. One note is that this needs to be diagnosed as bursitis or tendinitis, and it's important because if someone treats it as bursitis and you don't do conservative treatment and you do an injection, such as a cortisone injection, if that bursa is inflamed enough, you go to put a needle in there to try to reduce inflammation, you could puncture that bursa, and now you've got real trouble rather than just reducing that inflammation. So while I'm not saying a cortisone injection is a bad thing, I prefer it to be tried after more conservative treatment, as I've just suggested. You need to have a practitioner take an MRI of that area to show whether it's that bursa that's inflamed or the tendon before an injection is tried, because if you do an injection again and that bursa is inflamed and they go into that bursa, you're going to have problems. You can see how this problem would be common in basis from keeping the arm out in that abduction either continuously or when it doesn't need to. For example, bowing, keeping the arm too far away from the body. Sometimes you're going to have to bring the arm out, certainly, but not constantly and not exaggeratedly, just enough to get what you need done. Many times players will learn from the beginning to keep the arm out at an angle, and this is a habit they get into, and maybe a teacher is more concerned with getting tones and technique right, and they don't correct that, and it becomes a learned habit and a bad thing, especially after decades of play. Also on the left you can see where that would come into play in the same way if keeping the arm out when navigating the fingerboard. Obviously you're going to have to do that sometimes, but you don't need to keep it out there all the time. So that's what we're talking about, trying to keep the arms close to the body when and as much as possible. Tendinitis and bursitis, you'll feel the pain like pressing in there like a doorbell, and you want to make sure that you try conservative treatment first. I find it works well. And again, cortisone if necessary, but make sure that an MRI is taken first. So please keep those tips coming. www.drkertz.com is my website. I introduced a blog recently to that site, so there will be more information available there. Also, my book, The Basis Guide to Injury Management, Prevention, and Better Health, always available there, or from your society. A few more months, we'll be in Colorado. Looking forward to it and to seeing you there. See you next month. Thank you.